We are live. We are live. Welcome to Medicine in the News. I'm Dr. Frita, and we talk about all of the hot health topics in the headlines. Today, we have a lot to talk about. Jamie Foxx. Y'all know and love Jamie Foxx. Well, you will recall that he was quite ill last year, and we never really found out exactly what happened, but it looks like he's back and better than ever. Well, he actually recently revealed some details about his illness, and so we'll talk about what happened to him and some of the other possibilities, and we'll do some education based on that. And then Kylie Jenner. Y'all know y'all watch the Kardashians. Well, some of y'all do. I don't know. But on the most recent episode of the Kardashians, they showed Kylie Jenner, and her anxiety caused her to ask the pilot to turn the plane around. And so we'll talk about anxiety, and we'll talk about anxiety disorder because many people live with it. And so we'll talk about how to recognize it and what to do. And then edibles. How many of y'all do edibles? How many? Don't answer that. Well, this is really serious because the FDA has actually put a recall out on certain edibles because there have been many illnesses and actually one death associated with an edible. So if you partake and like to have yourself a little fun with gummies and chocolates and the various edibles, please stay tuned because you want to make sure that you're not partaking in this particular edible. And then let's talk about the Olympics. Are y'all getting excited about the Olympics? Well, the gold medalist Olympian Suni Lee talks about her living with kidney disease. Yes, she's been diagnosed with what she calls an incurable kidney disease. And you know, I'm a board certified kidney doctor. We'll talk about that. And then lastly, my favorite part, the live Q&A. So get your questions together. I'll be answering your questions right here live and on stage. Go ahead and like and share this video and come on back for a good old time with Medicine in the News. All right, we are live. I'm Dr. Frita, and it's time for us to get started with these hot health topics in the news. Y'all know I don't do this thing alone, so come on up, co-host Shador and my practice manager. How you doing, Shador?
Doing good, Dr. Frita. How are you?
I'm doing well. We got quite a few topics to get into, and I'm excited because I know our med heads here in the chat always have something to say. So yes. Let's go ahead. Let's talk about some of this celebrity news. And as always, I will share evidence-based information to help us all to live our healthiest, happiest lives. So as we get started, make sure y'all go ahead and like and share this video. It lets YouTube know that we are here and we are giving evidence-based information. All right. So let's talk about edibles. We know a lot of people, enjoy themselves some edibles. And some edibles are legal, some not so much. But there is a particular company that has been, selling edibles, including chocolate bars and other tasty treats. But their edibles, unfortunately, have been found to make at least 48 people ill. 27 have been hospitalized. And there has even been a death that is believed to have been caused by this particular edible. Okay. And so as we get started, I want y'all to put a 1 in the chat. Put a 1 in the chat if you think that edibles should be legal. And we'll talk more about that. Put a 1 in the chat if you think they should be legal, and then give us a little bit of an explanation if maybe you think there should be some type of a caveat to them. All right, so let's go ahead and get started with this story.
There's been a national recall for all of Diamond Shrum's edible products. The FDA and the Wisconsin Department of Health Services are investigating reports of severe illnesses associated with the Diamond Shrum's chocolate bars, cones, and gummies with psychoactive compounds. Toxic levels of mushroom chemical have made dozens of people sick in 20 states. Symptoms include seizures, nausea, and abnormal heart rates.
All right. So these specifically are the Diamond Shroom edibles. And what they found is that there's actually a mushroom toxin that has been making people very ill. And it's even potentially lethal because there's been 1 death associated. And it's so serious that the FDA put out a recall. All right. So when we talk about edibles, we're talking about a whole lot of different things. Probably the most common ones people talk about are the ones that have the components of marijuana. Okay. That will give people a certain euphoria and a high. This one specifically was with mushrooms, and there was a mushroom toxin, muscanol, that was found actually in these edibles. FDA's recalled them. So please, for everyone, if you know people who partake kind of casually in edibles, or if you go to parties and you just, grab a gummy or you grab a chocolate bar and you don't ask questions, because if it's one of these diamond shroom edibles, it has been recalled. And so I'm curious, we can get into a little bit of a discussion. Who's the first person in the chat, Shador?
Yes, our first person today comes from Ursula.
Hi, Miss Ursula.
She says hello from Sikeston, Missouri.
Oh, Missouri. Do you know, I've never been to Missouri. Would you believe it? Have I been to Missouri? I haven't. All right. Thank you. Welcome. And thank you for joining us. All right. Do we have any ones in the chat?
Absolutely. So,
and look, and what was my question? If you put a 1, what does that mean?
Should edibles be legal?
Should they be legal?
Yeah.
All right. What did y'all say?
So, Benny, first one to chime in with a 1.
Hi, Benny. You think 1, they should be legal? Okay.
Riley.
Should be legal. Okay. What else? Hi, Riley.
We got a lot of no's that should not be legal. Monica.
Okay. What did she give a reason? Hi, Monica.
Yeah, she said kids think it's candy.
Ooh, let's talk about it, Monica. Let's talk about it. Okay. Because, and you'll even see in that packaging for the video we just showed, it was really colorful and exciting. And if y'all go back on my Instagram at dr.frita, there was a video I did a short, because there was a time, and the time is still now, where children were going to the emergency rooms with overdosing from edibles because they were seeing the gummy bears that their parents were enjoying. And for children, they were overdosing, and it could be quite toxic to children. And, we see something similar, Monica, when we look at the vapes, which has been kind of a big controversy, right? Especially when the vapes first came out, they would be advertised with these really exciting flavors, chocolate mint, bubble gum, and even the people in the ads were kind of young, cool, hip kind of people with, who would have been attractive to a childlike audience. Very similar to when cigarettes first hit the market. They had Joe Camel, the cool kind of a camel with the shades, appealing to children. And so, yeah, it does feel like, since we know that a lot of times the advertisements are geared toward attracting children, then there should be some type of a regulation, which has been done with the vapes, but perhaps it should be done with the edibles as well, because it's true. I mean, they even have these potato chips that look very similar to really popular potato chip brands or chip brands, and it's attractive to kids. And so if it's something you can just grab at a gas station, it's not locked behind a bar, or, you don't have to have any type of a regulation to get it, then it does put the kids at risk. Okay. So Monica's not having it.
Not having it at all.
All right. So back to these diamond shrooms. So what happens with these diamond shrooms? So it's the mushroom toxin is there, okay, and it's in the chocolate bars, it's in the gummy bears, and what the intention is when you take this mushroom that's the edible, then it's supposed to create some type of a euphoria or some type of a high, perhaps even a bit of a hallucination, like a hallucinogen, okay, to create that kind of an effect that people go for. But in this particular company, they found that this muscanol was actually so high that it was at a lethal level for many people. Almost 50 people, at least 48 people have reported in over 24 states getting very ill. Okay, 27 have been hospitalized at least. There's been 1 death. So this is really serious, and it lets us know that there's a fine line with some of these edibles and some of these products. We know that when we're dealing with products like with cannabis, THC, things of that nature, there's no doubt that there are medicinal properties for certain edibles in that sense, or certain oils. But what is the fine line? When you don't have things that are regulated, it can be quite easy, right, for you to end up with something that has a lethal level. So we're still trying to kind of navigate that. But specifically, make sure you share this with loved ones who partake in edibles to make sure they don't have any diamond shrooms. And you can know that potentially your edible, it could be potentially toxic if you have some of these symptoms. If you have agitation, involuntary muscle cramps, seizure, nausea, vomiting, if you have abnormal heart rhythm, Okay, these are some of the symptoms that were reported in the people who went to the hospital, who reported themselves as having an illness. So just be careful and make sure you consult with your doctor, even though for a lot of these edibles, your doctor is not exactly going to be prescribing them. They might not even condone or agree with you having them, but it's important that you have the conversation. Okay, have the conversation with your doctor. HIPAA is in effect as far as your privacy, but at least your doctor can let you know some of the potential side effects, some of the potential fatalities of some of these edibles, and your doctor can talk to you about certain medications you're on that may not interact well, or if you already have hypertension, if you have some type of a chronic disease, your doctor will be able to advise you. So don't keep things like this a secret from your physician, please, and consult with your doctor. And if you're doing diamond shrooms edibles, stop it right now, because the FDA has put them on recall. Yep. All right. So before we get into this next story, and y'all make sure you like and you share this video, I want to see, I know we had a couple of questions, at least several questions actually, but there are a few I wanted to highlight from last week's live. So let's look at one of these questions before we get into the Jamie Foxx topic. Okay. And as I talk about this next question, I want you all to tell me a little something about Jamie Foxx. He has shared to a degree, which we'll talk about, some of the illness that he went through, but largely he's been very private about it. I want you to put a 2 in the chat if you think that even though he's a celebrity, that he has the right to his privacy, and put a 3 in the chat if you think that too much is given, much is required, and he should tell us what's going on so that we know. Put a 2 if you think he deserves his privacy, or put a 3 if you think that when you sign up to be a celebrity, you get all the goods and you have to get some of the bad, which is a loss of privacy. All right. Okay. What's one of these questions we missed, Shadora?
Yes, ma'am. So this is from last week's live, of course, from Yusefa.
Hi, Yusefa.
Can CKD, chronic kidney disease, drink lemon water?
Okay. Can patients with CKD or chronic kidney disease drink lemon water? Thank you for that question. And make sure that you check out my YouTube video right here on this channel, Dr. Frita. Very proud and very grateful to say that we have over 735,000 subscribers, even more of that at this point, I'm pretty sure. A lot of great information. Check out the video on CKD stages, chronic kidney disease stages, to give you an idea of the 5 stages. But as far as lemon water, the answer in general is yes. Of course, as always, everything I give on this channel is informational. It does not replace the advice of your physician. So make sure you consult with your physician. But in general, lemon water is something that's wonderful. And it's actually something that I encourage and something that I do myself. And I recommend it to my kidney patients. Water, of course, is wonderful as far as staying hydrated. You want to make sure, especially if you are in a pre-dialysis phase, you stay hydrated, because dehydration can be a cause of worsening kidney disease. It can cause pre-renal azotemia. Consult with your doctor about how much water you should drink. For many adults, it's 2 to 3 liters a day. Consult with your doctor. And then lemon water in particular can be really great because lemons are loaded with vitamin C. We know that vitamin C helps to increase your white blood cell production, which helps you to fight infections and also helps to shorten the duration of illnesses, specifically respiratory illnesses. Lemons also are loaded with citrate, which help with your digestion, and lemons can actually help to prevent kidney stones because of the citrate. So yes, in general, lemon water is something that is good for patients with CKD. Again, consult with your physician, and also check out my video right here on this channel on the benefits of drinking water for your kidney health. And I'll tell you what, let's just talk about this, because I have a freebie for you. I'll make sure I put it in this description, and it is 10 healthy habits for a better you and a better life. And I talk about the habits just in general for your health. And one of the habits I have in there is actually drinking lemon water. So yeah, make sure you check this out. It's free. The link will be in the description. And thank you for that question. All right. So now let's talk about Jamie Foxx. Now, y'all know Jamie Foxx has been entertaining us for years. I first remember him, as a comedian in watching Living Color, where he would play Wanda. He would do impressions, a master impressionist, really. And then I remember being shocked, Shador, that the man can sing.
Oh, yeah.
He can sing, right? And, he's had all kinds of wonderful hits. And then the other hit, Blame It on the Alcohol, among many. So then I had that shock. And then I was shocked that the man can act. Okay. And is actually an Academy Award winning. Remember, he portrayed Ray Charles. I mean, the man can act down, right? Well, you will recall that in April 11th of 2023, Jamie Foxx actually fell ill. He was on set recording a movie with Glenn Close, with Cameron Diaz, and then it was reported that he fell ill, fell unconscious, and then kind of fell off the radar, where his family kept things really close to the vest. And, you know, his daughter was the spokesperson really for him, Corinne, and she guarded his privacy with all of her might. And she did a great job, because to this day, we really don't know the details about his illness, but we know that we did not see from him. We did not hear from him for months and months and months and months, until he came back out on the scene where he was talking, walking, looked pretty healthy, but still he never actually revealed what the problem was, right? He still actually did not reveal what the problem was. Well, fast forward just now here in July 2024, he's come out and he shared a little bit more about what's going on with him. And so let's take a look at this clip, and then we'll talk about it. And then I'll see what y'all said in the chat. 2, he has a right to privacy. 3, forget it. He needs to tell us all his business.
Look, April 11th last year, bad headache. Asked my boy for an Advil. It was gone for 20 days. I don't remember anything.
Wow, scary. Jamie Foxx has finally revealed what led to his mysterious hospitalization last year. While in downtown Phoenix, the comedian was telling a group of people how on April 11th of 2023, he had a bad headache and asked his boy for some Advil. Jamie then snapped his fingers and said, "I was gone for 20 days," and admitted that he did not remember anything.
So they told me, I'm in Atlanta, they told me my sister and my daughter took me to the first doctor. Next doctor said, something going on up there.
As you may remember, Jamie's oldest daughter, Corinne Foxx, announced on April 12th of 2023 that her father experienced a medical complication, but due to quick action and great care, he was already on his way to recovery. 3 weeks after that, Jamie posted a simple message on his Instagram story saying, "Appreciate all the love, feeling blessed." It wasn't until last July that Jamie elaborated on what he calls his hellish experience. However, he did not reveal an exact diagnosis. He thanked his inner circle for remaining tight-lipped about his condition, and the following month, the Beat Shazam co-host told his fans through an Instagram post that he was finally starting to feel like himself after an unexpected dark journey. The good news is Jamie will be able to walk his daughter down the aisle as she prepares for her upcoming wedding.
All right. So Jamie Foxx still didn't give a whole lot of details, but he did say that he had a headache. He asked his boy for some Advil, and then like he snapped his finger and said for 20 days he doesn't remember anything. So what we'll talk about today, we'll talk about the facts that we have out of his mouth. He said he had a headache, and so we'll talk about some of the different causes of headaches, primary headaches and secondary headaches, and then we'll talk a little bit about, just based on his symptoms, some of the possibilities. Again, we still don't have exactly what he had, but we'll talk about some of the possibilities, like did he have a stroke? Did he have a brain tumor? I don't know. But first, Shador, who says that 2, leave that man alone, he has a right to his privacy, and who says 3, because he's a celebrity, there's a certain bit of privacy that he forfeits and that he should share? What
So
are
I
the
haven't
mad heads
seen
have to
any
say?
3, surprisingly. Everyone is chiming in with the 2s.
That he should have his privacy.
He should have his
All right.
privacy.
Who says he should have his privacy?
So Marcia,
Hi, Marcia.
she says absolutely has a right to his privacy.
Very good.
And
And he's got a great team, because I mean, nobody has leaked it. So that's pretty awesome.
And Kanisha, hi Kanisha.
Hi, Kanisha.
She deserves his privacy, as we all do, celebrity or not. In the verse that was just quoted, "To whom much is given, much is required," that was taken out of context. It doesn't refer to his privacy.
Very good. All right.
And then we have Miss Catherine. Hello.
Hi,
She
Miss
said,
Catherine.
Jamie has a right to his privacy if he has a condition which makes him harder to insure that affects his wallet. He has a right to privacy. Sounds like he may have had a stroke, but I'm guessing. That's
good. That's good. All right. All right. Anyone else have any comments with their numbers?
No, just a lot of numbers. Number 2s, 2s, and 2s.
That's good. That's very respectful. And again, he's had such a wonderful a wonderful team that they have protected him. But of course, right here on Medicine in the News, what we do is we do take the topics and the headlines and we use them for good and for education in order to share what's going on. So
you do have 3 popped in here.
What 3 popped in there?
Miss V.E. Hall says 3. That comes with the territory when in the public.
Very good. Okay, with the territory. So, you know, by the way nature is and the way paparazzi is, there absolutely is just going to be some type of a limitation to his privacy, as we see, because, you know, if he weren't a celebrity, we wouldn't know at all what was going on with him. By the same token, if he weren't a celebrity, he would not have the millions and millions of dollars, the movie deals, the endorsements, all of those things. So it is a balance. And unfortunately, when you are a celebrity, you do have certain amounts of your privacy that are gone. But I do appreciate the fact that most of the people here do respect his privacy. But as far as what he has shared, let's talk about what we know and what we're not speculating on, which is headache. And I'm going to ask you in the chat, put in some of the causes of headaches. So he said he had a headache. He was out for 20 days. Put in some of the causes for headaches. Okay, so in general, a headache, of course, is just that, is an ache in the head. And there are 2 different types of headaches, okay? You have secondary headaches, which are caused by some type of an underlying condition. And I'll wait and see kind of what y'all put in the chat, and we can go from there. And then you have primary headaches, where there is no underlying or secondary cause, but the headache is the illness. So let's start by talking about the primary headaches. So do we have anyone in the chat who's put in some of the causes so far?
Yes, we have. So paralegal. Oh, where you go? Paralegal. Hi,
paralegal.
High blood pressure and stroke.
High blood pressure and stroke. So those would be 2 of the secondary causes, okay? But absolutely 100%. High blood pressure can cause headaches. Certainly when you have the pressure inside of the blood vessels in the brain, the pressure can lead to a headache. And the hypertension in and of itself can actually lead to a stroke, specifically a hemorrhagic stroke or a brain bleed. So let's go ahead and take a little detour in talking about strokes, because of course, you know, it can be kind of interrelated. So as far as the strokes, so if you have a brain bleed, so say you have hypertension and then you get a headache, then boom, that could lead to a stroke that would take you out for 20 days. We don't know if that's the case for Jamie Foxx, but this is a potential scenario. There are 2 types of stroke. And by definition, a stroke is when you have an insufficient blood supply to a portion of the brain, okay? So you can have an ischemic stroke, which is when the blood supply is cut off, okay, oftentimes by some type of a clot. And that's the most common one. About 85% of the strokes are ischemic strokes. And then you can have a hemorrhagic stroke, which is by a brain bleed. So if someone has a stroke due to hypertension that causes a brain bleed, that happens in about 15% of the cases. And then you get a brain bleed from the stroke. The 2 have completely different treatments, but certainly they can cause different deficits. But the thing to remember is be fast. These are some of the symptoms that can happen with strokes. So you can have balance problems. You can have vision problems or eye trouble. You can get facial or arm drooping. You can get arm or leg weakness. Okay, so you get facial drooping, and then you can get arm or leg weakness. You can get a slurred speech. And if you get those things, it's time to call 911. Make sure you check out my YouTube video on stroke. Okay, anyone else give a cause for a headache?
Absolutely. So we also have, go to my, Marsha says dehydrated or dehydration.
Yes, dehydration can cause a headache. In fact, right now in the middle of the summer, we've had these temperatures up to like 100 degrees. And of course, the dehydration would be considered a secondary cause of a headache. My kids will be like, oh, Mom, I got a headache, you know, after they've been outside playing and sweating and sitting up here trying to find Kool-Aid or sodas or anything sugary to drink. I say, go drink some water. And typically that will reverse the headache. So dehydration is definitely a cause of headache, right? The kids come in and tell me they want sodas. No, drink some water. Yeah, that's a good one. Twilight.
Hi, Twilight. Stress.
Stress can cause headache for sure. Stress can cause a whole lot. Stress can cause a lot of physical symptoms. But yeah, stress can cause a headache. Oftentimes the stress will send those stress hormones up, like cortisol, adrenaline, that can cause your blood vessels to tighten, which can cause the blood pressure to go up, including the pressure of the vessels in your brain can lead to a headache. Absolutely. What else? Any other ones?
From Jocelyn.
Hi, Jocelyn. Diet. Well, if you have a very high salt diet, then sometimes that can lead to hypertension, which can lead to headache. And different people, especially if they have migraines, certain things in their diets can trigger the migraines, which can lead to a headache. So now let's talk about some of the primary headaches. So in the examples we just had, like hypertension, stress, dehydration, those were secondary causes, okay, an underlying condition causing the headache. But now let's talk about some of the primary causes of headaches, okay? And so migraines. I'm sure many of you have heard of migraines. Put a 4 if you either have migraines or if you know of someone who has migraines and you've kind of witnessed them with some of the symptoms. Those can be pretty debilitating, because I know, I don't have a diagnosis of migraine headaches, and I remember going through medical school and kind of learning, but until I actually had patients who had migraines, or even classmates who did not show up sometimes on major days because of the debilitation of a migraine, I didn't fully understand until witnessing it firsthand. So a 4, if either you have a migraine or if you've witnessed someone firsthand who's had the symptoms of a migraine. So with the migraine headaches, they tend to affect one side of the head, and they tend to be severe, moderate to severe pain, okay? Mm-hmm. And oftentimes patients with migraines don't want to move, okay? They want to be still, they want to be in a dark room, and they just leave them alone, okay? There can be different triggers. For some people, it can be a menstrual cycle trigger. Some people, it can be certain foods that they eat. There are different triggers to migraine headaches. And yes, there are different treatments for it. Make sure you consult with your physician. The interesting thing about migraines is that they often have an aura or a prodrome, meaning that 24 or even up to 48 hours before the migraine comes, you might get certain sensations, tingling, flashing lights, even nausea. And many people who have migraine headaches, based on that prodrome, those symptoms that come before the actual headache, they can time it and they know they're about to get a headache. So a migraine headache is one of the primary types of a headache. Any 4s for people who either have migraines or have seen and witnessed a loved one or someone they know with the symptoms of a migraine.
Absolutely. So we have Janetta.
Hi, Janetta.
Okay. Lisa has a 4.
Hi, Lisa. Yeah, the migraines are pretty common.
Mm-hmm. Sheila.
Hi, Sheila.
Okay. And then Marcia, she says, my sister, and she ultimately had a stroke.
Oh, I'm sorry. Well, I pray your sister's doing okay. And see, that's another thing, Marcia, with the migraines and even some of the other primary headaches, sometimes the symptoms can be very similar to a stroke. And so if you're a person who's had, headaches and you've gotten tingling, even tingling on one side of your face, or these different symptoms, you may have gone to the ER a million times and you're like, oh, it's just my migraine, it's not a stroke. Oh, it's just my migraine not a stroke. But then that one time, it could actually be a stroke. So I'm really sorry that happened to your sister. There is an overlap sometimes in the symptoms. Yeah.
Yeah. I've been taken out with these migraines. Whew.
Okay. Speaking of taking out, I want y'all to know Shadow just turned off my light. She just walked on my cord. Excuse me. Shadow.
I know it went dark momentarily.
A moment of darkness. This is a do-it-yourself production. Oh my gosh. All right. So yeah, that's one type. So another type of a primary headache is the tension headache, right? So speaking of that stress, it can lead to tension, because like if you are someone who's stressed out, then that can cause a contraction of muscles in the neck, in the upper back, in the scalp, and that can lead to a tension headache. And typically with the tension headache, it's on both sides, okay? Almost like a band. And those headaches can be mild to moderate in general, okay? Whereas the migraines can really get up to being super severe. The tension headaches tend to be mild to moderate. And it's actually one of the most common causes, if not the most common cause, of the purchase of analgesics or pain medicines in the United States. So tension headaches are really quite common. But yeah, those are a primary headache. And there's another one, Shador, a cluster headache. That one tends to be unilateral, and it's on one side. And the interesting thing about the cluster headache is it often affects the eye. Like someone can get like a red eye on one side, and those tend to be quite severe to the point where some people with cluster headaches report, many people actually, wanting to unalive themselves. Those are some of the severe headaches. So those are some of the primary ones. Anyone else mention possible causes of headaches?
Yes. So Dank, Dragon.
Hi.
He pituitary tumor, acromegaly.
Interesting. Okay, so the pituitary is a portion in your brain that makes the hormone, the growth hormone. Okay, and if you have too much growth hormone, then you can get Giant's disease or acromegaly, where you can be very tall, get a big wide jaw or mandible, have a large tongue, spaced out teeth. And if you have a large pituitary tumor, not just from acromegaly, but you could have a pituitary tumor that's making a lot of prolactin. You can have other portions of the pituitary that are large, but either way, yes, it could lead to a headache. And definitely that's a secondary cause of headaches. That's a good one.
Yeah, very good one. Beverly, sinus.
Did you say sinus?
Yes.
That's a common one. Put a 5 in the chat if either you have had sinus headaches or you know of someone. That's a common one. Shador, you know, we see that.
I put 1,000 5s for myself.
Yourself 1,000 5. Yeah. And especially up here in Georgia, people who didn't even know they had allergies will often, sit up here and have allergy symptoms. And yeah, you can get sinus headaches. And so, so either the different places, like right kind of next to your nose and the forehead, you can get them kind of in the chin, the different places where you have sinuses. And yeah, it can cause really quite debilitating headaches. And so as far as that, of course, consult your doctor, but you definitely want to make sure that you treat any underlying allergies. So in some cases you might use like nasal saline or even nasal steroids like Flonase or something like that. For some people, they might need medications like a Claritin, an Allegra, a Zyrtec. And in cases where it actually becomes, this is a nightmare. In cases where it actually becomes bacterial infection, there's a problem. Y'all, my goodness. I
do not want you to be great today.
It won't let me be great.
Shadow making an appearance. She's been away.
Now I'm not going to let the stress of this light going off give me a headache. So let's just kind of keep on moving on. All right. So that's one of the things with Jamie Foxx. He did share with us that he had a headache and then he was out for 20 days. And again, we don't know if he had a stroke. We already talked about stroke as being a possible cause of a headache. And some other things that can cause headaches, are, of course, are brain tumors. Again, we don't know about Jamie Foxx, but just in general, brain tumors such as glioblastoma. We know that President Biden's son, Beau Biden, passed away with a glioblastoma. And we know that Ted Kennedy passed away with glioblastoma. And then Michael Strahan's daughter, Isabella, is living with a medulloblastoma, which is the most common cause of brain tumor in children. All right. So one thing for certain, regardless of the numbers, we definitely are praying for Jamie Foxx, wishing him well. Reportedly, he is back in action, literally recording that movie with Glenn Close, Cameron Diaz. And one thing I've noticed, Shador, about Jamie Foxx is that he has been exceptionally grateful. He's been grateful to the fans, grateful to his team, grateful to his daughter. I mean, grateful to God. He has been pouring out his expression and in his being appreciative. So I definitely am appreciative of that. He's a super talent, as we know. And so we're pulling for him. We're wishing him the best. Meanwhile, we are kind of sharing information so that we all can live our healthiest, happiest lives. And hopefully some of what he's gone through can signal us to make sure we're taking care of ourselves and that our loved ones are taking care of themselves. All right. Make sure you go ahead and like this video, put a thumbs up for us, share, kind of click that share button, copy the link, put it in your group chat, send it to your friends, tell a friend to tell a friend. And then, let's go on to the next topic, Shador, shall we?
Yes, shall. Let's do it.
All right. Oh, my goodness. Kylie Jenner. How many of y'all watched the Kardashians? Now, I'm curious about this. Put a 6 in the chat if you watched the Kardashians or if you ever sit and do a little binge watch. I watched it quite a bit when it first came out. And now I kind of see what's going on in the different highlights. But on the most recent episode of the Kardashians, Kylie Jenner was on the plane. They had a family trip that was planned. And they were supposed to be going to Aspen, right, for a wonderful skiing trip. And they were sitting in the plane, their private jet, and it was delayed because of snow and visibility problems, right? And so they were sitting there, it was delayed. And apparently the pilot was talking about some potential alternate routes that would be safe. And Kylie was questioning it. She's like, are you sure it's going to be safe? How can you be sure? And we know by history that sometimes when you have private jets, they're somehow able to fly even when the commercial planes do an absolute in stopping, right? Sometimes the people who are in the planes with the more money, the more power, the more influence are somehow still able to fly even when there's been warnings. We've seen that in the past, unfortunately, right? Well, here's what happened with Kylie Jenner. She said, no, ma'am. She, even when they got ready to take off and go through to a place where the pilot thought would be safe, she's like, stop the plane. And she literally had the pilot to stop the plane, turn it around so she could get off. She said she was having anxiety about it. Even a couple of days before the flight, she was having anxiety about it. And so let's talk about this, and we'll talk about anxiety disorder. And as we get ready to talk about anxiety disorder, if any of you know some of the different types of anxiety disorder or symptoms of anxiety disorder, go ahead and put those in the chat. But let's go ahead and take this clip. Look at this clip on Kylie.
The Kardashians have a runaway on the runway.
The minute Kylie says, turn the plane around, I want to get off. I know she's serious.
There was a lot of drama, like major drama.
Major drama when Kylie Jenner turns the private jet around, pulling the plug on a family ski trip.
I'm really good with flying. I am now. I wasn't in the past a few years ago. I've gotten much better, but I am having a lot of anxiety.
It's always like this.
The fact that she always gets out of the
It all went down on the latest episode of Hulu's The Kardashians, which saw the youngest sister's anxiety reach new heights.
It was so scary.
Or not exactly, since she tapped out on the tarmac.
Really bad feeling the last 2 days.
Even last night, Kylie, why would you say that? No, that's worse that you would put
I
out there.
couldn't even sleep last night.
Kylie, the fact that you even put that out in the universe is one of the weirdest things. That's a terrible thing to say.
Genuinely, I cannot believe it.
Kylie, Khloe, Kim, Kendall, and their momager, Kris Jenner, were all excited about taking a family ski trip to Aspen for a post-holiday getaway.
I am very excited. I've been wanting to go to Aspen this year.
I honestly can't believe Kylie showed up.
Don't get too excited, Kim. The series of events, well, first, a weather delay.
The captain said there's going to be about 30-minute delay here on the ground because weather and ride fault.
I was having such anxiety.
Then the captain suggests landing in Grand Junction and driving the 3 hours to Aspen, which Kylie isn't down for.
I'm just saying, I don't want to drive 3 hours in the snow.
And as the Kardashians prep for takeoff,
Kylie's anxiety is kicking in, and I totally understand.
Kylie takes off herself.
I'm just not comfortable right now, and I'm thinking about my kids. I'm maybe dramatic, but I feel like something isn't safe.
Mama Kris was sympathetic to Kylie's intrusive thoughts.
I know the girls are upset, and they're upset because they wanted to spend time with Kylie.
Family's family. But her sisters were kind of over it.
I just really can't believe Kylie managed to get out of everything.
She always does.
She always does. You just got to roll with it.
We made it to Aspen, -1.
We'll have to wait until next week to see if Kylie makes it to Aspen. But in the meantime, the trip isn't exactly smooth sailing.
I feel like you love nitpicking me. And we did the exact same thing.
Oh my goodness. All right. Did anyone share that they watched the Kardashians?
Yes, we did have a few comments here.
Let me see what they have to say about the Kardashians. And also, I want you to comment on if you don't blame Kylie. Like, put a 6 in comment if you don't blame Kylie. Because her sisters were pretty hard on her, I felt, in that clip.
We're at 7. 7 if you don't blame
Kylie. 7 if you don't. Okay.
So Meekness, put a 6.
Okay. For watching the Kardashians?
Watching Kardashians. Dank says, my daughter loves to watch them.
Okay.
And Catherine says, I tried but couldn't.
I mean, yeah, it's kind of one of those, I think, one thing, regardless of your opinion of the Kardashians, the thing that cannot be denied is the genius of the momager, Kris Jenner. She was able to take people with, at least initially, arguably minimal, obvious talents, at least, you know, their talents, I suppose, but things that weren't traditionally obvious talents, and was able to make wealthy people out of her family. She has the Midas touch when it comes to that. So if nothing else, you have to respect the marketing, I do believe. All right. But let's talk about anxiety. And would you say we're up to a 7? If you agree with Kylie, and if she's having those bad feelings, the visibility's down, she already is feeling bad about it. Because you notice I talked about her having anxiety, and we're going to talk about anxiety disorder, but anxiety in and of itself is not necessarily a disorder. Okay. So anxiety is basically when you have thoughts and worry about things that could potentially happen. And anxiety in a lot of ways can be protective, right? If you see your kid and they're about to walk across the street and you know that your kid is maybe not looking up and not that careful, you might have some anxiety, like, is my child going to get hit by a car and maybe we should go another route? Sometimes anxiety just in and of itself, a worry that something may happen, could be life-saving, but it becomes a disorder when you have these intrusive thoughts that really interfere with your life, and the worry is not always founded in reality. And by definition, if you're having these intrusive thoughts every day, or at least most days, for at least 6 months, okay, then it could be called anxiety disorder. So case in point, if let's say you need a job, right? You have no job and there's a really great career opportunity, and the opportunity is in California. Okay. Well, if you absolutely refuse to get on the plane to go to California because there's a possibility that you could have an accident, but then you also don't want to take a car because there's a possibility that you can get run off the road, but then you also don't want to take a train. And so then you won't go. And then let's just say you do decide to go, but once you get there, you're like, I'm not going to take this job because there's a possibility that we could have a drought here. There's a possibility we could have a fire. There's a possibility we could have an earthquake. All things that could happen. But if the thoughts for that job keep you completely from going out for it, and if you find a worry that's really, you have anxiety about everything, then you could potentially have anxiety disorder, because then you might say, you know what, never mind, let me go and try to get a job in New York. But same thing, you don't want to fly, you don't want to drive. And you also think that there's crime in New York, so something could happen to you. You don't want to get an apartment because there could be an infestation of rats in your apartment. If there's always an intrusive worry and it's keeping you from, and it's blocking you from having regular daily activities, then it could potentially be a disorder. Okay. And especially if it starts to become physical, leading you to stress, hypertension, it could be an anxiety disorder. All right. Did anyone mention, or did they think that they agree with Kylie? Did anyone mention any of the types of anxiety disorder?
Yeah. So Janetta agreed with Kylie, placed a 7 in the chat.
Mm-hmm.
And then, so a couple of symptoms, I guess. The chosen one. Hello.
Hi, chosen one.
Sweating and rapid heartbeats.
Very good. Very good. Which actually, that can happen with any of the anxieties, but very specifically, one of the types of anxiety disorder, panic disorder, specifically with a panic attack, then you can get sweating, rapid heartbeat, chest pain, hyperventilating. And oftentimes people with a panic disorder will present exactly like they're having a heart attack, right? They'll show up to the ER. Symptoms are the same as an acute myocardial infarction or a heart attack, but then the EKG is normal, except for having a fast heart rate. The enzymes that are done by the ER are normal. And they do these workups and they realize it's actually a panic attack or panic disorder. But absolutely, those are some of the symptoms. And yes, panic disorder is one of the types of anxiety disorder. And, and I agree with the Kylie. I don't know her whole history, but the isolated situation does not feel like a disorder. It feels like an anxiety that has a basis in very possible realities. If you're told that the visibility is down, if the plane is delayed, if it's snowing, and if you're in California and you definitely know of friends who have been in similar situations, or other celebrities who've been on airplanes when everyone else was told the visibility was down, then that anxiety doesn't necessarily sound like a disorder, not isolated. I actually agree with Kylie on this one also. All right. Anyone else with any symptoms or any types of anxiety disorder? And then we'll go over the 5 types. One has actually been kind of removed and it's a separate disorder in and of its own, but we'll talk about some different types. We already talked about panic disorder as one of the types of anxiety disorder. Anyone else?
Yeah. So Twilight agreed with you with panic attacks.
Mm-hmm. Absolutely. It's scary. You got people no different than a heart attack. But the other thing that's scary is sometimes young people can get heart attacks. And oftentimes people in the ER are like, oh, you're just being hysterical. Oh, it's probably just anxiety. and it can be a heart attack. So it's important that the thorough workup is done when clinically appropriate. Yeah.
Yeah. And Catherine, she agrees with Kylie's choice. Flies enough. This one too. I respect Kylie's choice.
I'm with you. And what she, and like what she said, she thought about her kids. Having kids will change a lot of things. I'm telling you, like, I am a little bit of an adventure person. I like zip lining. I've done scuba diving, jet skiing. I'm definitely a big roller coaster person. But as I get growner and growner, a lot of decisions I make about what I'm going to do, not even so much that I'm scared or have a super fear, but I think, what if I fall off the zip line and I have kids, you know? So she mentioned she thought about her kids. So these things kind of play into it. So I agree. All right. All right. So we'll go over the other types of anxiety disorder. And if there are any questions, we'll put those in the Q&A part. But so we talked about panic disorder, and then we just have generalized anxiety disorder. And that's more what I was talking about when you have these intrusive thoughts that even when things start to be a little bit illogical, because you can sit here and you can come up with the possibility of something bad that can happen in any situation, any day of the week. You know, you can walk out of your front door and all of a sudden the tree falls down. We can't predict these things, but if you are allowing these worries to be intrusive, again, most days for at least 6 months, then you might have generalized anxiety disorder. Consult with your doctor or with your mental health care provider. And then, so the panic disorder, another one, PTSD, post-traumatic stress disorder, right? And we see a lot of this in our veterans, people who've been, serving our country in wars. Also people who unfortunately have been victims of abuse, who've been, witnessed, a lot of violence, firearm violence, things of this nature. A major trauma can cause a post-traumatic disorder where different sounds can trigger you into having the symptoms of anxiety, the fast heart rate, the sweating, the worry, the stress. Okay. So post-traumatic stress disorder is another type. And then obsessive compulsive disorder, which is more in its own category now. At one time it was thought it was just an anxiety disorder. And that's obsessive compulsive disorder, or OCD, when there is a certain prioritization of order or of symmetry or of cleanliness, to the point where there is an obsession where it's good to wash your hands. And Shador, you know how I am. We go through hand sanitizer in our office, like I don't know what. But if you're someone who any little thing you touch, you have to go wash your hands, or you just wash them to the point where your hands become chafed, or even when the skin starts coming off and you still always feel dirty. Okay, that could potentially be a symptom of obsessive compulsive disorder, at least obsessive compulsive trait. Consult with your doctor. Or if you're obsessed with symmetry, like if you have the cans in your pantry, and if you have 2 cans on one side, 3 on the other, you have to have 2 and 2, to the point where it might make you not even go on with your function. Or even if you check the lock like 5 times, you get up out of your bed, you go downstairs, you walk down the hall, you have to keep checking the lock. So make sure, check out my video, because I can talk about this all day. I have a video right here on this channel where I talk about the types of anxiety disorder right here on this Dr. Frita YouTube channel. And you know what, Shadora, this is one of the you can tell the videos that I did during lockdown, okay, during the virus, which now is starting to be on the rise again, because I think of this video, my hair is in full natural afro mode. You remember on the lockdown, I didn't go anywhere, certainly not to a hairdresser. So that means I had no pressed hair, no braided hair, no extensions in the hair. It was just afros and afro puffs. And I think I have myself a nice big old blowout, twist out afro in that video, but I go into detail. All right. Make sure you like this video and tell a friend to tell a friend, because we are giving evidence-based information on the medicine in the news, hot health topics in the headlines. And we're using what we're finding in the news and with what celebrities choose to share. We're taking it and we're using it for good for all of us to be able to live healthier, happier lives. All right. So for our last topic, before we get into our Q&A, it's my specialty. For those of you who've been following us for a while, you know that I am Dr. Frita. I'm a board certified nephrologist, meaning I'm a kidney doctor and a high blood pressure doctor. So that's what I do day in and day out. And we have an Olympian, a gold medalist, in fact, Suni Lee, who shared that she has been diagnosed with a kidney disease. So let's talk about what she has shared, and then we'll go for it.
It feels absolutely insane. It was just such a hard, incredible journey. There were so many times where I thought about quitting and just giving up because I was so sick, and like it was just so hard to like stay motivated, you know, watching everybody get better and I can't even get back into the gym and constantly like self-doubting myself. But once I had those people around me who lifted me up and supported me, I knew that this was something that I wanted.
Okay. So what you will learn if you actually look her up, the Olympian Suni Lee, you'll learn that when she actually had to pull out of competing at one point because she was trying to do the competition and she had swelling in her feet, her legs, in her fingers to the point where she was falling off of the bar. And her coach had her to see a physician, and they asked her to do a urine test. Now, at that point, she shared, well, actually, I've been having trouble making urine for the last couple of weeks. And then they went on and they found out that she did have a kidney disease. She did not disclose the name of the disease, but she did say that it caused her to have so much swelling that she actually gained 40 pounds. Okay. And so for her to gain 40 pounds, presumably it was 40 pounds of fluid. And again, she didn't reveal the exact name of it, but just as a nephrologist, as a kidney doctor, if someone has swelling all over, face, hands, feet, fingers, and they gain 40 pounds of fluid, especially a petite appearing person like Suni Lee, then very likely it is due to nephrotic syndrome. Okay. Again, she hasn't revealed that specifically, but nephrotic syndrome is just the symptoms she described will cause nephrotic syndrome. And there are many types of nephrotic syndrome. And basically it's when your kidneys are leaking out excessive protein to the point where you get a whole lot of swelling. If you have any questions about nephrotic syndrome, I will go into more detail, but you can really get a lot of information if right here on this Dr. Frita YouTube channel, you go to my video where I talk about nephrotic syndrome and nephritic syndrome, because these are syndromes that aren't talked about very much. But if you miss the symptoms, then potentially you can have a progression to kidney failure that could potentially have been stopped by the proper medication. The Olympian Suni Lee has shared that she's doing better. She's competing, you know, she's trying out, you know, we expect to see her in Paris and everything for the Olympics. But she does say it does make her a different gymnast than she was, and she has to get more rest, and she takes a medication for what she has. So I go into so much detail on nephrotic syndrome. So if y'all have any questions, then I'll go into those questions right here in the Q&A section. I will just briefly say some of the potential causes of nephrotic syndrome. There's something called minimal change disease, FSG or focal segmental glomerulosclerosis can cause it. Lupus can cause nephrotic syndrome. Even just having diabetes can cause a nephrotic syndrome. So there's a bunch of different causes, but with the Olympic season coming out and her sharing the kidney disease, I thought it would be appropriate for us to educate ourselves on that. All right. So let's take these last few minutes for some Q&A. Shall we, Shador?
Yes, let's do
All
it.
right.
All right. This comes from Emilia. Hello.
Hi, Amelia.
Please, menopause, can it cause panic attack and depression?
Oh, well, now menopause and even perimenopause can definitely be associated with mood changes. Make sure you consult with your physician. But the hormonal changes and beyond just the physical changes that the hormonal changes can cause, when you look at what menopause actually represents, it does represent getting closer to, you know, the end of a life well lived. No, it doesn't mean you're going to fall out tomorrow, but it does mark getting older. And we know we live in a society that has a lot of ageism, so that can be problematic. Oftentimes when you're dealing with menopause or even perimenopause, you can have vasomotor reactions, or you get hot flashes, which can be very upsetting. It can be embarrassing even socially, and that can cause an issue with the mood. And, you know, when you're having the perimenopausal symptoms, oftentimes it can be associated with weight gain and weight in places that you never gained weight before. Okay. Like in the belly, you can get belly fat, and that can change the way you perceive yourself. It can affect your self-esteem, and that could trigger you to go into a depression or even a major depressive disorder. So there definitely can be an association. Consult with your physician, find out what treatments will help you to have the least amount of symptoms in the safest way. Thank you for that question.
Thank you. The next question comes from the number 2B, native.
To me. Okay.
What about infused cucumber water for kidney disease patients?
Okay, so I definitely do recommend cucumbers for many patients with CKD. In fact, if you, right here on this channel, I have different videos where I talk about foods that are good for kidney repair. And I also have, just in a recent video, 10 summer fruits, top 10 summer fruits that are good for blood pressure. And I have cucumbers in there. Oftentimes, so cucumbers are a very hydrating fruit, like they're over 95% water. They have different vitamins, different antioxidant properties that often will help increase vascular flow to the kidneys. So if you chop yourself up some cucumbers and put it in water, even put some lemons in the water. Some people want to put ginger root in the water. Things of that nature can help you to get some of these antioxidants and some of the vitamins. But check out my videos. I'll talk about cucumbers quite a bit right here on this channel. Thank you for that question.
Thank you. Next question comes from Sheila.
Hi, Sheila.
Can you take a bare aspirin sometimes to keep your blood thin?
Okay. So the data has actually changed recently on aspirin. There was a time when aspirin, specifically low dose aspirin or 81 milligram aspirin, was recommended for most people over the age of 40 because we felt like it was could help to prevent heart attacks, could help to prevent strokes, right? But then in a more recent review of study, even though, yes, aspirin can help to thin the blood and potentially help to decrease heart attacks and strokes. And it does so because what the aspirin does is it keeps platelets, those blood cells, platelets that kind of help you to clot. It keeps them from being so sticky, right? And so if you're in a situation where you have a plaque in a heart vessel and a platelet is coming by, it's less likely to stick to the plaque and cause a clot if you're on aspirin. Okay, the platelets are less sticky. Okay, so that was the original premise in taking aspirin to prevent heart attacks and strokes. But here's the problem. We also found that taking the aspirin in many patients was causing stomach bleeds, right? GI bleeds, gastrointestinal bleeds, or ulcers. And so then it becomes weighing the pros and the cons. You know, is it worth it to take aspirin to prevent heart attacks and strokes? Or are you increasing the risk of having stomach bleeds? And then take it a step further when you're dealing with people who are elderly or people who have poor balance and have an increased risk for falls. Well, if they're taking aspirin and their blood is thin, then if they fall and hit their head, well, heck, they can have a brain bleed. And that takes us right back to the brain bleeds, hemorrhagic strokes that we talked about earlier in the segment. And so the most important thing to understand is that you need to consult with your physician to find out the risks and the benefits of aspirin. But for patients, for doctors who do recommend it, they recommend a low dose aspirin, 81 milligrams a day, and an enteric coated one, meaning one that is less likely to cause stomach bleeds. Okay. And so, yes, the aspirin can help to thin blood, but it can also cause some bleeding problems. So this is a very individualized question for you to consult with your physician about.
Thank you very much. And then one more from T Chosen.
Hi, T Chosen.
How can fatty liver disease be reversed, or can it?
Oh, yes, it can be. Yes, it can be in some situations. So I'm glad you mentioned the fatty liver disease because there are different risk factors. So of course, you know, when we think about liver disease, we often think about alcohol. Oh, somebody had alcohol and now they have fatty liver disease. And yes, if someone is having an excessive amount of alcohol, that could lead to it. But many people have fatty liver disease who don't even drink, who don't drink in excess. And they can get a non-alcoholic steatosis, or they can get a fatty liver disease that is not related to alcohol at all. One of the risk factors is if you're a person who's living with obesity. And some people who aren't even living with obesity are just genetically predisposed to having a fatty liver. Well, if you have a fatty liver, and if your fatty liver is because you're a person who's living with obesity, then what we have found that in many cases, if you're able to get to a healthy weight, or at least closer to a healthy weight, then you can have some reversal in the fatty liver disease. And one thing that I've studied, because I've shared here that I am board certified in obesity medicine by the American Board of Obesity Medicine, and a lot of these medications that are being used for weight loss, specifically the GLP-1 agonists like the Wegovy, the Zepbound, the tirzepatide, Mounjaro, semaglutide, Ozempic, these medications, in many cases, when they cause the dramatic weight loss, the fat loss, it has been shown that there has been some improvement in fatty liver disease. So if you're someone who's living with obesity, if that's the cause of your fatty liver disease, then getting toward a closer weight in many cases can reverse the fatty liver disease. Make sure you consult with your physician. There are other things that can cause fatty liver disease as well. But if you're someone who, if you have more specific questions, I do offer a service where I can get more into it. I have a concierge telehealth service. So for some questions that are detailed that require me to know more about your history, then I will do that on a telehealth visit. I've been having very good success for people who really want to either just get a second opinion from me or to ask detailed questions. I'll put the link in the description of this live where we can get more into it. That's a good question, though.
Very, very good question. Thank you, Dr. All right, just a couple of comments and I'll have you out of here.
All right, as we close on out, y'all, please make sure you like and you subscribe to this YouTube channel. Like I said, we're well over 735,000 subscribers, and there's so much content on this channel that I'm very proud of, because I take pride in giving evidence-based medicine and sharing it in a way that's easy to understand. So you can share these videos with your loved ones. You can learn from the videos. And if you have comments, put them down here. You know, make sure you put them here, put them on my videos, and we address as many as we can. And of course, yes, please make sure that you like this video, you share it, you tell a friend to tell a friend, because it lets YouTube know that we're here giving evidence-based medicine. All right, what are our last couple questions here?
All right, this comes from Theophilus. Hello.
Yeah, I love the name Theophilus, and mainly because my mama loves the name Theophilus. She wanted to name my little brother Theophilus, but she named him Junior. You know how that goes. But yes, hello, Theophilus.
He says, hello, everyone. This is Theophilus and wife. We get our first book today of yours, Dr. Frita, Under Pressure. Can't wait to dive in.
Thank you so much. I appreciate you for that. I'm very proud of this book. As you will see, yes, I talk about medicine. I'm traditionally trained. I definitely do prescribe medicine when necessary, but I also talk about natural and holistic ways and how you can integrate the both. Thank you so much, Theophilus. I appreciate you for that support. And for anyone else who wants the book, you can click the link in the description here. Or you know what? The one-stop shop really is my website, www.drfrita.com. That's DRFRIT, as in take care of yourself, .com. You'll find the book. You'll also find my favorite things, Dr. Frita's favorite things, including the juicer I like to use, the Nama J2 juicer. You'll find a good home blood pressure cuff for monitoring your own blood pressure. All that's on my website under Dr. Frita's favorite things. Thank you for the support.
Thank you very much. Next one comes from Ralph. Just a couple shout outs. Hello, Dr. Frita.
Hi.
I'm so proud of your accomplishments. And my daughter is a nurse practitioner, and I'm so proud of her. God bless you and your family.
Oh, thank you so much. I appreciate that. And I'm proud of your daughter, being out here and really, trying to promote health in the community. Everyone is not interested in doing it, and it can be quite challenging, but, for everyone who signs up for it and for your daughter, because I know that's no small feat, getting to be a nurse practitioner. I'm proud of her, and I thank you. I appreciate you for your support. That was nice.
Absolutely. Thank you very much. And a couple of admirers here, Dr. Frita, from Mark.
Oh.
He said, I think you're very pretty, doctor, and I like the natural look. You was talking about your nice.
Oh, so he went and saw the video. Listen, if you like that natural look, then you go right. Thank you. You go right from 2020 all the way. I think finally in 22, maybe I started going back to the hairdresser, but I'm going to give you blowout and top knots and Afro puffs. Look, I wasn't with it during the lockdown. I was locked down and we were all the way. I still don't have a relaxer or a perm in my hair, but I wasn't even playing. But thank you. I appreciate that.
And Catherine agrees that Dr. Frita is gorgeous.
Oh, that's so sweet. Y'all know they got nothing to do with medicine, but I like it. Thank you.
All right, Dr. Frita.
All right. That sounds good. Oh, I did there was one question, Shadora, that I remember that we did miss. It was kind of a complex question, but we might be able to get to that next go round. Oh gosh, I think someone talked about adrenal insufficiency, something that was, I'm talking about.
Yeah, do
we have that one? Yeah, let's slash that one up right before we head right out the door.
All right, this is from Sir Willie from last week's YouTube Live. I get so confused as to what to do as a person of color with secondary adrenal insufficiency, along with hypertension and hypotension, along with a neuromuscular disease. Exercise ?
Okay, so that is an excellent question, but you already know that it requires a super complex answer. And so when you're talking about the adrenal glands, you're talking about those two triangular shaped organs that sit right on top of the kidneys. Okay. And they give different hormones like adrenaline. They help with our cortisol levels, all of that. But if you have adrenal insufficiency, then it can lead to issues with blood pressure like hypotension. It can lead to chronic back pain. It can lead to high potassium. It can lead to low sodium. There's all kinds of issues and there's different causes. For this, the answer to this type of question, in order for me to give it justice, then you would be a perfect candidate to at least check out my telehealth concierge service. Of course, you'll want to consult with your own physician and consult with your endocrinologist. But if you want to get my aspect on it, where I can really give you some good quality information and get detailed history about what you're going through, then check that out. I'd be more than happy to have a one-on-one conversation with you. And for everyone else here in the chat, and for those of y'all listening to the replay right here on this Dr. Frita YouTube channel, I have a couple of videos. These are some of my original videos back in the day where I go into detail about adrenal insufficiency. And specifically, I talk about one of our past presidents who had adrenal insufficiency. Oh, I'm curious. Medheads, does anybody know what past president had adrenal insufficiency? If y'all know this, so we're going to close out this room and you win the prize. We have a past president who had adrenal insufficiency, a very popular past president. That's all right. Go ahead, check it out right here on this YouTube channel where I go into detail about adrenal insufficiency and that past president. The mystery, the suspense. All right, Shador, does that take us on out?
Take us on out, Dr. Frita.
All right. Well, I thank y'all for watching. We'll see you not next week. Not going to be here next week. So we'll see you in 2 weeks right here on Dr. Frita's Medicine in the News. All of the hot health headlines, hot health topics in the headlines right here. I appreciate y'all for watching. I love you for the support. And y'all go on and have yourselves a wonderful night. All right. Thank you, Shador.
You're welcome. Good night.
Good night.